What if disordered eating patterns are not about willpower, control, or body image, but rather neuroinflammation? I'm Dr. Krista Morton, certified emotional eating coach and integrative doctor, and I help people figure out if their disordered eating patterns are connected to mold toxicity. A note to our readers, this article is meant for educational purposes only and is not a replacement for medical advice. An appropriately credentialed clinician should monitor diagnosed eating disorders. Do you ever feel like your body is working against you? Do you struggle with patterns of self-sabotage and control around eating? If so, you're not alone. Eating disorders affect approximately 28.8 million Americans, about 9%, at some point in their lifetime. Anorexia nervosa, an eating disorder categorized by food restriction and a biochemical state of malnourishment, holds the highest mortality rate of any mental illness. Approximately 30% of Americans report emotional or disordered eating patterns to cope with emotional stressors in their lives. Disordered eating encapsulates irregular, unhealthy, or emotionally driven eating patterns that do not fit into the diagnostic criteria for a diagnosed eating disorder. According to a European study, 70% of individuals with eating disorders have coinciding conditions, such as anxiety and mood disorders, which are the most common. Individuals coping with chronic illness are susceptible to disordered eating due to coping with the chronic stress of their condition, as well as the common use of restrictive diets to manage chronic illness or disease. So let's talk about how mycotoxins specifically affect the body and the brain. What do these statistics reveal? These statistics and common themes found in eating disorders or disordered eating patterns show us that there are two common routes to developing an unhealthy relationship with eating. Number one is a biochemical imbalance, such as seen in anxiety and depression, that creates a vulnerability to disordered eating. Number two is an emotional stressor that requires a coping mechanism. The biochemical and somatoemotional repercussions of mycotoxin-related illness are consistent with these two pathways that can lead to disordered eating patterns. The common system amongst these pathways, the hypothalamic pituitary adrenal axis, or HPA axis for short. This leads us to talking about mold colonization in the sinuses and how that drives up neuroinflammation. So let's talk about what's happening here with the HPA axis. In order to understand how mold exposure can lead to disordered eating or eating disorders, it is essential to understand the relationship between mycotoxins and the HPA axis. Inhalation of toxic mold spores often colonize in the sinus cavities. Colonization that is not addressed can lead to a host of additional symptoms in the body due to the mycotoxins, microscopic mold spores, that are omitted from these colonies even after the source of toxic mold exposure is removed. I explain this to my patients as your body becomes the petri dish. The thin barrier between the frontal sinuses and the pituitary gland can actually begin to erode or calcify with long enough persistence of these fungal colonies. This can lead to increased neuroinflammation, inflammation of the brain and nervous system due to a compromised blood-brain barrier, the protective layer around the brain. The pituitary gland acts as the master conductor of hormones in the body. The anterior pituitary is tasked with signaling stress hormones such as cortisol and endorphins, while the posterior pituitary releases hormones that also influence the central nervous system, such as vasopressin and oxytocin. When the pituitary gland becomes dysregulated, the patient is often left with too much stress hormone, cortisol and endorphins, and not enough feel-good hormones, aka oxytocin. In addition, the midbrain region is responsible for releasing dopamine, a pleasure-provoking neurotransmitter that has a symbiotic relationship with oxytocin and is often depleted or non-efficiently absorbed by the cell wall in elevated neuroinflammation. With brain inflammation caused by mycotoxin-driven oxidative stress, both dopamine release and dopamine uptake can become impaired, resulting in neuropsychiatric symptoms. This is a recipe for anxiety, depression, and addictive behaviors, aka addiction to food, restriction, or control, revolving around the mesolimbic reward system. This cycle is a part of a system in our brains called the mesolimbic reward system. It involves the limbic cortexes of the brain, including the hippocampus, the amygdala, and the nucleus accumbens. In the two most common eating disorders, anorexia nervosa and bulimia nervosa, there is a dysregulatory factor in the mesolimbic reward system. For those who struggle with bulimia, emotional eating, or food addiction, the reward pathway is hyper-aroused by food and often leads to the overconsumption of non-essential calories. In anorexia, this reward pathway is also hyper-aroused, but focuses on the dopaminergic reward that follows restriction and control. Another important piece to the puzzle is understanding the role of leptin in the body and how mycotoxins impact leptin's function. Leptin is the body's satiety hormone and is deeply connected to the mesolimbic reward system. Leptin's job in the body is to signal fullness and satisfaction when eating. It is responsible for signaling the mesolimbic reward system to be satisfied when the necessary amount of nutrients is consumed at a given time. Mycotoxins are notorious for contributing to leptin resistance. This is a state that occurs in the body when leptin is being released, but the receptors aren't hearing it due to oxidative stress in the hippocampus. This can lead to feelings of excessive hunger or the need to continue eating for emotional satisfaction, even when enough food has been consumed. In tendencies of food restrictions, such as seen in anorexia, the mesolimbic reward pathway is responding to the satisfaction of being in control through restriction. In addition, it is very common for mycotoxins to create symptoms of nausea or a lack of appetite, which can be attributed to stress on the liver, gallbladder, and often a provoking of dysglycemia, which is dysregulated blood sugar. These symptoms commonly lead to food restriction. Let's talk about the mental impact of chronic illness. In addition to these biochemical pathways, the interplay between mycotoxins, dysregulation of the HPA axis, and the mesolimbic reward system, it is important to acknowledge that disordered eating can begin as a coping mechanism to the stress of chronic illness, such as chronic inflammatory response syndrome, CIRS for short, or mast cell activation syndrome, MCAS for short. Two common conditions that are associated with toxic mold exposure. Sadly, mycotoxin illness is poorly understood in conventional medicine, and many individuals with mystery symptoms caused by toxic mold exposure experience years of delayed diagnoses. Coping with the stress of the cycle of chronic illness and the frustration that comes with not feeling heard or understood can create significant isolation, which creates the equal and opposite biochemical benefit of being in community, which is oxytocin. Binging or restricting can become a means of supplementing a facade of control and empowerment in response to feeling very out of control in one's health. Outsourcing support for this aspect of disordered eating is highly encouraged, as the nervous system is not really craving food or restriction, but rather craving a source of being seen, heard, loved, known, and understood. Those who are healing from chronic illnesses are often put on therapeutic diets. While food can act as medicine to the body, long durations of restriction, as is often required of certain nutritional therapies, can begin the cycle of restriction either in quantities or varieties of food. This may stem from an element of fear of symptom provocation or a means to gain control and create hypervigilance or even borderline obsession with controlling one's diet. This is often referred to as orthorexia in the mental health community. So let's summarize our key takeaways on the relationship between mycotoxins and disordered eating patterns. Number 1, mold and mycotoxins disrupt the HPA axis, creating hormonal and stress response imbalances that affect appetite and mood. Number 2, neuroinflammation from mold impairs dopamine and oxytocin, increasing anxiety, depression, and vulnerability to binging or restricting. Number 3, leptin resistance caused by mycotoxins disrupts fullness cues, leading to overeating and in some, a loss of appetite in others. Number 4, the mesolimbic reward system becomes dysregulated, making food or the control of food a coping mechanism. Number 5, chronic illness, stress, and feeling misunderstood can drive emotional eating or restrictive patterns as a way to regain a sense of control. And finally, number 6, therapeutic diets used in chronic illness can unintentionally foster restrictive eating patterns, as long-term food rules, fear of symptom triggers, and desire for control may lead to hypervigilance or obsession around eating correctly, a pattern often described as orthorexia. Here are some resources to support disordered eating. You are not powerless. There are many resources which address these conditions between mycotoxins and the mechanisms of action that lead to disordered eating. Let's talk about supplementation. The first remedy I like to use for this condition is crabapple Bach flower essence. Bach flower essences are one of my favorite tools for creating emotional harmony. Crabapple flower essence can be helpful in supporting emotional healing in disordered eating by softening body shame, perfectionism, and obsessive clean or controlled eating patterns, promoting greater self-acceptance and a healthier relationship with food. Microbalance Health's microflora mood and mind support. L-platyrum DR7, the primary ingredient in this probiotic, helps to lower oxidative stress, which can contribute to damage to the dopamine receptors and leptin resistance. The next one is phosphatidylcholine. Phosphatidylcholine, or PC for short, helps to repair the integrity of the cell membranes, which restores the sensitivity of dopamine and leptin receptors, which were damaged due to oxidative stress. Additionally, it supports the function of the liver and its ability to release toxins through efficient bile flow. This is essential for detoxification of mycotoxins. Microbalance Health's Celtropin. This homeopathic is designed to repair the HPA axis, which, as discussed earlier, becomes largely dysregulated in mycotoxin illness due to fungal colonization in the sinuses. Its formula is designed to offer relief to the chronic stress cycle and calm down feelings of stress and anxiety. And finally, Microbalance Health's Breathe Easy Kit. This combo nasal rinse and spray kit can help support the clearing of fungal colonies in the sinuses when used on a regular basis. This indirectly supports the health of the HPA axis due to the proximity of the sinuses to brain parts, especially the pituitary gland. Here are a few neuroemotional support tools. Create a dopamine menu. Understanding that the root of disordered eating stems around the needs of the mesolimbic reward system being met helps to inspire other means of meeting these needs outside of the reward brought by either food or restriction. Often I help my patients understand how their behaviors are influencing this reward pathway, and they then think of other ways to get this need met. Write all of these options down and take the pressure off to never binge again or never skip a meal again if you're struggling with binging or restriction. Rather, focus on crowding out by visiting the options on the dopamine menu and then making a strategic decision around how you will meet your body's needs. Sometimes this includes an indulgence. The idea is to assist the brain and the body to agree that there is more than one way to get this need met. Some common dopamine menu items that my patients have benefited from include grounding, getting out in nature, calling a friend, cuddling a pet, asking for a hug, playing a song that is uplifting, or taking a bath. One of my personal favorites is a chocolate meditation, which uses a highly pleasurable food to provide a moment of mindfulness. It is practiced by taking one small square of chocolate and observing all of its qualities, the way it looks and smells first, and then the way it tastes and makes your body feel as you allow it to slowly melt on your tongue. No chewing. This is a user-friendly way to pause and practice a full body scan, which increases your awareness around the somatic sensations of your body and boosts dopamine and oxytocin levels. Emphasize the multifaceted nature of food. Food is more than just nutrients and numbers of calories to sustain life. It is also more than pleasure. Food centers around cultural and spiritual traditions of gathering around the table. It connects us to those we love and cultivates connection to those we've recently met. Food can be a part of celebration. Food also nourishes every physiological process in the body and can significantly impact the health and vitality of the body, as commonly referred to as the concept of you are what you eat. Food is all of these things. The problem begins when there is a hyperfixation on one of these elements, as opposed to a well-balanced relationship to each of the roles food plays in the physical, social, and spiritual layers. If the needs that food meets are out of balance, true nourishment is not actually achieved. Reflect on which aspect of food may be most dominant for you and create a plan of action to practice the elements of nutrition that have been left behind. This may be scheduling a lunch with a friend or making yourself a nutritious meal in your kitchen. Address underlying factors. As previously mentioned, coping with the repercussions of chronic illness, such as those provoked by toxic mold exposure, can prompt unhealthy relationships with food. Rather than focusing on behavior modification around food, I invite you to see the behavior as a symptom to the underlying problem, which will still remain even after the behavior is modified, coping with the stress, fear, and feelings of body betrayal that often accompany chronic conditions. It can become very easy to slip into a pattern of self-punishment in chronic illness, as it is common to feel that the body is betraying you. Find a trusted therapist or mentor to dialogue with you about this and help to retrain the brain to see the body is working for and not against you. A technique that I love to use in my office to facilitate emotional breakthrough is parts and memory therapy developed by Dr. Jane Norix, as well as brain tap technology. Concluding thoughts. Understanding the connection between mycotoxins and disordered eating reveals a powerful truth. These patterns are not rooted in weakness or lack of willpower, but in real biochemical changes, neuroinflammation, and the emotional toll of chronic illness. Mold exposure can disrupt the HPA axis, impair dopamine and oxytocin, interfere with satiety hormones like leptin, and dysregulate the mesolimbic reward system, creating the perfect storm for binging, restricting, or using food as a coping mechanism. This doesn't mean the cycle is permanent. By repairing the brain-body pathways affected by mycotoxins, supporting the HPA axis, nurturing the mesolimbic reward system, and addressing the emotional weight of chronic illness, healing becomes possible. When we view disordered eating through this integrative lens, compassion replaces shame, and we can finally support the body not as the enemy, but as a system calling out for safety, nourishment, and connection. If this topic resonated with you, check the show notes and watch the live that we did on this topic. Thank you so much for watching today, and I'll see you next time.